Hello viewers, welcome to Education Frontline Africa, a platform that is focused on bold discussions, sound ideas and real solutions shaping education in Nigeria and Africa at large. I am your host, Emmanuel. Today, we'll be looking at a very important question of discussion. Who takes care of the teachers? We're trying to look at teachers' welfare and mental well-being. We've been told teaching is a noble profession. The nobility does not pay rent. It does not take care of bills. It does not restore burnout energy. So again, we ask this very important question, but yet uncomfortable. Who takes care of the teachers? Today with me in the studio, I have an important guest, a mental health expert, and the country representative of Secure the Future International Initiative. Her organization is focused on human development through mental health therapy. And she's here today to lend her voice to this discussion. With me today in the studio is Dr. Chinenmerem Iwanyanwu. You're welcome to the studio.
Thank you so much.
Okay, let's get on to the discussion. Before you came here, we've had a guest, a teacher representative who has shared his view on the pressure that is experienced by teachers in the classroom, having been in team profession for over 2 decades. Now I want to start. What can we say are the early warning signs that a teacher is mentally drained?
The early warning signs that one or teacher is mentally drained is one. At that point when there's a mix-up of emotions, when emotions overlap. Somebody is saying good morning to you, you're supposed to respond. The next thing you're saying, so what's good about the morning? All right? When you are expecting someone to appreciate you for what effort you're putting in the work and you're not getting it, so you just believe that nobody's ever seen what I'm doing, nobody's ever going to do, try to appreciate me, so what the heck? You understand? You get careless with things because you feel unappreciated. Then you have issues where you throw tantrums to the wrong people that are not connected to what the problem is, are the people that now get you upset, or you more like you transfer aggressions to them. Then you have the issue of sleeping disorder. You're not sleeping well. You cannot explain why you can't sleep well. You have the issue of overthinking things, getting paranoid, overthinking everything. You have issue of eating disorder too, because that's a mental health, that's a signal, a sign that there's a mental health issue. When you're not sleeping well, when you're not eating well, when you're getting highly irritable, when you're being erratic, when you're not just being erratic, when you are misdirecting your emotions. So at that point, you are overwhelmed. You are being drained, mentally drained. Then you have the issue of mixing things up. You said something to this person, then tomorrow you come back and say, are you not the one I told that? When he was not the person you had that conversation with. So you are no longer retaining, your retentive memory is not functioning as it should. It's been strained.
Lack of coordination.
You are not coordinated. So these are signs. And a lot of times you see people trying to say, don't mind that woman, she's always shouting. She's not shouting because she loves shouting. Sometimes she even don't recognize herself. But the truth is she has gotten used to it, and it's normalized. But there's a mental health issue. So it's a whole lot.
Wow, that is enlightening actually. That is enlightening. Especially when you talked about the issue of transfer of aggression. It's very relatable. So a child, you lash out at a child in class over something that is not that important. Truly. That's right. Okay, ma, going on, ma. So why do you think teaching in particular, is vulnerable to burnout and emotional drain?
Wow. Do you know what it means to teach a human being? Are you done teaching one? Not to talk of have 5, 10, 20 in a class, 50. They are all different, unique personalities. I come across a mother who has 3 kids, and she was having issues with her husband. And when I spoke with her, I could see she was exhausted. She was emotionally drained. And I asked her, how are the kids? She said, oh no, madam, you don't know. I said, what do you mean by that? He said, do you know what it means? You wake up in the morning, you have to make 3 different breakfasts because the 3 of them are not ready to eat the same thing. So imagine a mother of 3 getting exhausted. Then you think of teacher that is having 50 of them in the class. And these 50 of them in the class have different learning styles. The way I absorb knowledge is not the same way you absorb knowledge. And for you as a teacher to come out as you have done your job very well, everybody have to pass that course. So it's a whole lot. This is where the burnout comes from. Being, on the job, trying to ensure that you transfer knowledge to that number of people you are facing. And unfortunately, in Nigeria, the standard of education here is so bad that you have 200 people in one class, especially the public schools.
Yes.
How do you get across to know what their peculiarities are? How do you get across to know what their individual differences are? All of these things, as insignificant as it is, affect studies, affect learning. So that's where the teacher out. Unfortunately, nobody talks about it. Everything we talk about is continuous assessment. Everything we are talking about is lecture notes. Lecture notes, standard, check. Continuous assessment, check. This one, nobody wants to know the other little things that come together to make learning comprehensive and holistic. So what leads to teachers' burnout is a whole lot. Just the idea of attending to more than one child learning needs is exhausting. Yeah.
So it's understandable why the profession truly it's demanding.
Very demanding. And don't forget, there are students that are already having their own emotional baggages, as little as they are. In public school, we went for an outreach, and a child came to meet us after we finished talking, came to meet me and said, Ma, I'd love to be your daughter. I looked at her, I said, what happened? Where's your mom? She's fine. Where's your dad? I don't know my dad. I only have a stepfather. What happened? Why are you interested in having a second mom? I love you. I'd like to be your mother, but I also want to know what happened to the first mother. I said, nothing, just that my mother don't care. Why? The stepfather is busy trying to defile her, and the stepmother the mother will not hear it. So imagine that child battling with such and is in the class. How does she concentrate? The things that happen to the children and what the teachers face sometimes is overwhelming. The teacher don't know what to do, and you see her just try to ignore.
Yes.
So it's a whole lot.
Thank you very much, ma. I think I'm really enjoying this discussion, and I'm sure a lot of our viewers are learning a thing or two from it. We've realized, like you mentioned earlier, that it gets to a point where teachers begin to normalize stress. They normalize it as if nothing will happen. It's part of the job. But at what point does stress, become a mental health issue?
Stress is normal. Let's not take it away. Stress is a normal life occurrence. And because it's a normal life occurrence, the body is wired to address stress. That's why you have the stress hormone. The stress hormones, the cortisons, you have the adrenaline, you have the dopamine and whatever. Now, when somebody feels stressed, you're agitated, the hormones are being released to address it. And there's the adrenaline, the flight or fight hormone. Once it is released, you are expected to take an action. Then you have the cortisol, which is the stress hormone, which kind of sustains the body as you are taking action in addressing this stress. But when you are stressed, the adrenaline the hormones are released, nothing happens. it remains in the body. And when it remains in the body, what does it do? It goes back to break down into sugar and other food nutrient components of substances within the system, byproducts of. So when that is the case, after a while, if you are constantly on that jump up, jump down, going up and down, juggling state, you'll find out that those hormones that are being released that are now converted into those substances like sugar and what have you, glucose, begins to become a problem to the body. So at that point, it's a mental health issue. It affects your mental state, it affects your physical body, and sometimes your emotions.
So that's where sleeplessness comes from, because they are there. You're restless.
You're restless. That restlessness. That restlessness is the presence of secreted hormones that are supposedly,
supposed to
used for action, fuel and action. But they are not fueling the action. So what happens?
Issues.
Thank you. So it's not a good thing for constant stress or for one to normalize stress. When you think that, oh, this is just it and there's nothing anybody can do about it, you continue your life like that. You don't know the body is just busy depleting day after day. Before you know it, there's a breakdown of some organs of the body. You hear stories of, this person died, though. What happened? They say it was kidney failure, but he doesn't drink, he doesn't do anything that shows he's, susceptible to having to get kidney failure, kidney failure as a health issue. Yes. But there are things happening inside of him that is dealing with his system. So mental health can never, ever be separated from physical health. The same way physical health is important is the same way mental health is important. Because when the mental health is, not optimal, it affects the physical body. To the point where you go to hospital and you have to be hospitalized. Yes.
Now, I'm going to deviate a little bit, because you raised a very important issue here. There's the need to act. When those hormones are released, someone needs to act. So what are the, strategic points you're going to give to teachers, because they're listening to us today, on how to deal with stress? What are the strategic points? How can they manage stress properly? Not just trying to cope with it, but really deal with it, so that rather than leaving these hormones settled in the body, they take the right set of actions and then they deal with it and they become wholesome teachers.
Okay. I'll use myself as an example. I'm one person that I try as much as possible to remove anything that will make me not sleep well. I don't like when I go to bed, my heart is palpitating because of one thing that happened that I did not address. So, as a person, always address issues as they come. But before you address issues as they come, there's something I teach people. Learn to name your emotions. That's the only way you can be able to tame it. If I come into this place and I'm very angry, and because I'm angry, I lash out at you, you get upset. At the point you are upset, it's important for you to ask yourself, what exactly in all of this that happened is upsetting me? It could be that the way I walked in here angry, like I'm carrying the whole world on my shoulder as if you are my problem, could be why you are angry. It could be the thing I said that is annoying you. It could even be the fact that I said it not to you in private, but in presence of somebody. So be able to identify the problem. What is that emotion? I'm angry. Yes, it's okay to be angry. But what got you upset? When you name it, you'll be able to say, okay, I didn't like the way he spoke to me. One, he came in angry, as if the whole world is falling on his shoulder. Also making it look like I'm part of his problem. I didn't like the way he spoke to me. And also, to top it all, he didn't say it to me in private. He said it in the presence of some of my subordinates. These are three things I've mentioned.
Yes.
Okay, because of this, I need to let him know that I don't like him speaking to me that way. The moment you go and talk to him and say, "Sir, are you okay? Can I speak with you now?" Fine. He's ready to listen to you. And he says, "Sir, I understand you were angry before you even got to the office. But the truth be told, I wasn't there. I didn't know what happened. And I didn't like the way you lashed out at me. You would have just given me opportunity to explain what happened. And you didn't do that. You also did it in front of my subordinates. How then do I face them tomorrow?" When you address this issue in a matured and a very courteous manner, you will see that it's either this person takes correction or this person gets offended, but you feel lighter.
Okay.
You feel better that you have said it.
Yeah,
Anything that comes afterwards based on him taking offense is no longer something that will bother you. It will be all about you now securing your position for him to understand that you are only trying to sort out this issue and draw the boundaries. Do you understand? So naming your emotions will only help you to tame it. Naming your emotions will only help you to address the source or the enabler. If you don't name your emotions, you will not even know why you're angry. You just keep getting angry, going with the circles. That's one. Then two, it's also very important for teachers to, have what we call clarity on issues. You could come in as a teacher and you are overwhelmed at the work that needs to be done. Where you feel overwhelmed, can you go to a higher authority who is more knowledgeable and experienced to ask, please, this, and this I'm supposed to do as the classroom teacher of this class. But these are the things I think I have observed are going to be problem. How do we go about it? Learn to have conversations on issues that are disturbing in your workspace, because whether you like it or not, they affect you emotionally. We human beings, I think 80% of decisions we make are guided by our emotions. So it's always intentionality that guides us to take logical steps and make decisions that are logical and objective. But in most cases, we find ourselves first response is emotion before we now sit back to say,
thank you.
So always go to ask for clarity. Be clear on what the expectations are. Also be clear on what you expect from the other party. It's important. Don't live on assumption they should know that they will pass this exam or they should know that they must write this test. No. Sometimes children don't understand why you should disturb them to write exams. You understand? Then the third but not the last, the last but not the least, and not the least, is seek help when you feel you are overwhelmed. Seek help. Professional, they say there are no professionals. No, these things that we talk about is abroad that you see people go to meet a psychiatrist, meet a psychologist, meet a shrink. No, there are people here in Nigeria that are also offering such services. Counselors are coming up every day. People are even becoming self-acclaimed counselors. So it's important to go to the right source and get professional help. It's not a bad thing. It doesn't make you someone that needs to be. It doesn't make you. It's not a sign of weakness. It's a sign of strength.
The last guest we had, like actually the president of the school, one of the things he said is, teachers don't talk about it. Most of the times they keep it to themselves. They don't even share among themselves. Of course, like he says, sometimes because they feel this man has enough problem with his own, so why should I share with him? But sometimes sharing with your colleague is the first step, I feel.
Yeah,
because it gives you the boldness to want to seek higher help. And sometimes that your colleague that you are looking down on might know somebody who, for example, now I've known that this is what you're into. If you know somebody shares with me and say, this is what I'm battling with, I can easily say, I have a card, call her, she can help. So I think teachers need to be more open
Yes, that's what I'm saying. They have
Yes.
to. You can't keep this to yourself. There's nothing like this will sound petty. No, it disturbs your sleep, so it's not petty. It makes you sometimes lose appetite to eat. It's not petty.
Thank you so much for everything you've said so far. While addressing the strategic actions that teachers can take, you mentioned the idea of seeking help. And sometimes this comes with financial responsibilities. So how do you think your organization can work with schools, school owners, so that we can have like set up within the school system so that teachers don't have to use, we already know that they're not in so much because we're told that their reward is heaven. Yes. So how do you think your organization, probably working with us, can come in to play a role to help schools set up these counseling facilities to help teachers probably manage stress?
Okay, thank you very much. SDF is a non-profit organization, and we've been doing a lot with schools. Currently, we have about 13 schools in the FCT that we have planted mental health school clubs. And the mental health school club is the safe space we are creating for students to come together, discuss about their emotions, and these conversations are being guided by the school counselor. So on every holiday, we are training counselors on mental health counseling, especially counselors where mental health school club is already established. So now, what we were discussing before, last year at our 4th annual counseling summit, we were able to launch our first publication, which was done in partnership with Counseling Practitioners Council of Nigeria, CPCN. It's called Effective Guide to Mental Health Counseling, Bridging the Mental Health Gap in Nigeria. So how can we work with schools? It's simple. If we can have access to schools and train their counselors, because every secondary school, every government secondary school in Nigeria, which I'm very sure of because I work with them, closely with them, have a school counselor. Unfortunately, these school counselors only do more of academic counseling, and in some schools, they are even being put in classroom to teach. Meanwhile, global standard is requiring that every 250 students should have one counselor that that attends to them. And attending to them means both the academic and mental and well-being. So if programs can be organized to put counselors through on how to use this manual, that way we have empowered them.
Yes, so the school can.
For the school to create a safe space for these students, because the truth be told, there is need for that safe space to be created. A lot of counselors don't even know that this thing called confidentiality in the practice is very serious, because being in the school environment, they are used to, you hear stories of children, you go to classroom and go and be discussing it, not knowing that these children sometimes gets to know that these stories have been discussed with other teachers and they were telling you in confidence. And that also deters them from now opening up to you. And you have, because of that praxis, you have students dying with their pain.
Which is why that training is very important.
Exactly. So it's important they understand. In fact, it's about unlearning and relearning. Yeah.
Unlearning and relearning.
Because a lot of the things we're going to say to them, they must have heard it in the university while going through their program as guidance counselors, but they never knew how effective and how damning it can be on anybody. And the environment they found themselves encouraged them to just get lackadaisical and not observe that particular ethics of the practice.
Wow. Thank you so much, Dr. Chinenmerem.
You're welcome, sir.
It's such an honor having you here. I'm sure our viewers have enjoyed every bit of the show. Thank you once again for coming on the show.
Thank you.
Everything you've said, they've been mind-blowing, they've been enlightening. I'm very sure that calls will start coming in, and we're redirecting them to you. of course, for experts, counseling and the rest. Once again, we appreciate your coming.
Thank you so much.
So once again, viewers, thank you for joining us on this show. Until next time on Education Frontline Africa, I remain your host, Chinenmerem.
Okay, on behalf of African Forum for Innovative Teachers, we say very big thank you, man. We are presenting this token to you from us.
Thank you so much.
Thank you for coming.
We appreciate this. And SDF, when they see it, we know we were here.
Yeah.
Thank you
so much, man.
Yeah.
Thank you.
We appreciate it.
Thank you so much.
All right.